Good morning. My name is Bobby Cagle. I'm the director of the LA County Department of Children and Family Services. I've been in that role for about 10 months now. My career is a 30-year career of provision of social services. I also, in my free time, serve on a number of nonprofit boards related to child care, child advocacy, child development systems of care, and have served in a number of roles as County Director of Social Services in both North Carolina and Georgia, providing child welfare and economic support services. Probably a turning point in my career was when I served as the Commissioner of the Department of Early Care and Education, which is a unitary organization that serves all the early education needs for children in the state of Georgia. At that time, I was able to interact with Dr. Jack Shonkoff, who I think has been a real change agent in the field, who worked with us on trying to change the thinking in our state about the way children learn. And we eventually became a Frontiers of Innovation state, which is a very limited number of states that are working with Harvard on the possibility of changing systems in a way that will help children develop their brains in a better way. I also subsequently served as the Family Services Director, Legislative Director, and then finally as the State Director of Family and Children's Services in the state of Georgia, and that is Child Welfare and Economic Services. And now as Director of the LA County Department of Children and Family Services, and is purely child welfare. I was thinking last night about my experience and the things that are needed to advance this at a policy level. Political will, which I think has been very well covered by the two previous presenters, is essential. Key policymakers understanding the kind of things that promote and inhibit child development, brain development is essential. Focused collaboration across governmental and community organizations is essential as well. One of the things that we used in Georgia that really promoted our ability to be able to change policy across agencies and have maximum effect was something called the Georgia Alliance of Education Agency Heads, which pulled together everybody from the early education community all the way through the president of the university system to align policies in order to make sure that we were covering children in the best way. It also takes citizens who are knowledgeable and actively advocate for progressive policies, and having those people who are really well connected in the community are essential to that as well. The science that we use in both early education and child welfare, I think, are similar. We are both just learning, as many of you are. Many of you are teaching us about brain development, trauma, ACEs, and resilience. We also, in child welfare, have begun to adhere to trauma-informed treatment approaches and two-generation frameworks, which allow us to treat both the child and the parent. Early education, I think, the ideas around brain development have really taken hold much more quickly, and I think for reasons that are pretty obvious. I would cover all these barriers and facilitators to the work that we do. I think what you'll notice in this list is that those things that are barriers really are also facilitators if you just apply them in the right way, and that you work with those that really need to be worked with. Political will and leadership is key in the state of Georgia. The work probably that allowed all of these things to happen there started in the 1980s with a governor named Zell Miller, who was later a United States Senator, who started the first universal pre-K program in the United States. And even prior to that, was so interested in brain development that he mailed every family of a new child a classical music CD to play with the child in order to promote brain development. It's also having people that are knowledgeable in policymaker roles. I can tell you that as I interact with my counterparts in LA County, most of them are really moving in the direction of using this as a basis for the work that they do. However, there are also key examples across the United States of people who are not familiar with brain development, not familiar with ACEs, that are in key positions that really need to know what we're talking about today. We also really need to have caretakers of children who are informed. I'm thinking in particular family members, but those relatives that care for children who are in our child welfare system. I think you're going to have an opportunity today to talk to both a birth parent and a relative who are caring for children in LA County. Having them understand the things that we're talking about, I think, will make a better opportunity for our children to get the care that they need and to promote their development. We also have, unfortunately, situations where caretaker isolation are a real problem. Having people that are so engaged in the care of children, especially those that have significant mental health and behavioral problems, that they are unable to themselves get out and have the kind of contact with others that they need in order to maintain their mental health and their physical health. And again, lack of collaboration kills things in government, and having that be something that is a focus is really key. I was also asked, because of the unique nature of Georgia versus Los Angeles County, to talk a little bit about the similarities and differences there. Georgia is primarily rural, very politically conservative, as you know, but unusually has a strong historical support for early education that was born out of the work of Zell Miller, and then really focuses across agencies with an alliance of all education agency heads. In Los Angeles County, being there for just 10 months, I'm just now becoming familiar with it. It is a primarily urban area, as you would expect. However, the northern part of our county, it's a 4,000 square mile county, is primarily rural, and it's an area where we're having a great deal of problems with lack of services. And I think Shields for Families, who's here, is an agency that can tell you a lot about the lack of resources in some parts of our community. It's a politically liberal area, not surprisingly. And the thing that I was looking at when I was about to come to LA County to work was the great focus in the county strategic plan on prevention work. We have spent or dedicated nearly $48 million to prevention through our community-based organizations in the last 2 budget cycles. We also are looking at the possibility of doing universal home visiting for every child born in the county on a voluntary basis. So I found in trying to advance evidence-based policy that, and this is something that I think many of my fellow department heads may want to really get back at me for. Requirements for utilization of evidence-based approaches tied to funding. A lot of the changes that you make in government only happen if you can say, they're making me, and we're going to lose funding in the event that we don't do this. Also, requirements for cross-agency and community collaboration. One of the key examples that I would point to in this area is the Early Learning Challenge grants, Race to the Top grants, back in the Obama administration. They had requirements that we work across agency and community lines, and also were really demonstrating that in their own work, because they had people at the Secretary's office level in both Health and Human Services and Department of Education who were purely dedicated to assuring that that kind of collaboration happened at the federal level. Education efforts touting the advantages of evidence-based practices, I think, is something that's very, very important. And also leadership of influential colleges and universities in the community. I think oftentimes as agency heads, we forget that we have these vast resources that are in our community, not just focused on teaching children, but also leading the community. Building and sustaining political will has been a great deal of what I have done over the past 30 years in my career. Understanding the respective political context, including key leaders and their philosophy, is a big part of what agency leadership needs to do. We also have to assure that key leaders have a good basic understanding of concepts and theories, and we have to understand how they learn those things in the most effective way, because not everybody learns in a setting like this. Sometimes it takes sending reading material home, one-on-one conversations. We also really need to remember that enlisting the assistance of influential private sector partners is key. In Georgia, making sure that we had the leaders of industry and business at the table with us to promote early care and education was a key thing for us. Also, having those key philanthropies in your state or your locale be a part of the work that you do is real key. And then making sure that you tie everything that you're promoting to funding, that you have a funding source for what you want to do, and that you've targeted that before you have the conversation. Thank you.
Thanks so much.